I'm a pediatric endocrinologist at Riley Children's Hospital and a type 1 diabetes researcher. I'm here with Dr. Emily Sims, who's also doing the session with me today. This is new drugs and devices, and so I know we have a lot of probably different people here with different experiences with diabetes, newly diagnosed, probably have been diagnosed for a long time, some very new to technology, some very, very well versed in technology. And so the way this session will go today is I'm going to do a bit of a review of what's currently available, so some of you may know a lot about it, and then Dr. Sims is going to give an update on the things that are in the pipeline, so a lot of the new things that are coming out. So again, feel free to chime in if you have questions as we go. We can take a few as we're going, and then there should be some time at the end. And so with that, we will get started. All right. Can people hear me? Am I good if we're, okay, excellent. All right, we can't move this forward anymore because it's attached to something, so I'm not trying to ignore anybody. So we're going to talk mostly about continuous glucose monitoring and insulin pumps today as the primary two new devices and drugs. And so the first thing I want to touch upon is continuous glucose monitoring. And one question is, what is a continuous glucose monitor and why would you do it? And I like this cartoon because I feel like anybody that's had diabetes for a long time, and I've had diabetes for almost 25 years now, but you find test strips everywhere when you're checking blood sugars, right? And it's kind of a joke, and so there's some funny memes, and I thought this guy was cute. So what is one reason people choose to do continuous glucose monitoring, which is a device that will monitor your blood sugar basically continuously. And one of the reasons it's attractive to people is that it can lead to checking your blood glucose like you traditionally do less. And we'll talk a little bit about some of the monitors and how they achieve that goal or maybe not. But that is one of the advantages, is it leads to fewer finger stick pokes. A continuous glucose monitor itself is composed of typically three things. You have the sensor, which is what's inserted into the skin, and that is what's detecting the blood sugar. Normally, that has to be replaced for most of them about every 7 to 14 days, depending on the sensor. And it reads the blood sugar level based on the fluid right under the skin. Along with the sensor, you have to have a transmitter, and so that's the device that's usually reusable. It's a piece of plastic, and that has to take the information that the sensor is reading and transmit it to somewhere where you can see it. So you have the sensor, the transmitter that usually sits right next to the sensor, and then a receiver. And so for some devices, and we're moving in the direction where a lot of times that's a phone, or an iPhone or a smartphone, or some sort of receiver where you can see the information. And so all the sensors are a little bit different, but those are kind of the three components. And so this is typically how it's set up. You can see the transmitter that sits on top of the skin, usually right on top of the sensor, which is what's actually inside the skin measuring the blood sugar. And then in this case, the insulin pump serves as the receiver in this example. In this case, and we'll talk about this a little bit more in the insulin pumps as well, you have a site for the insulin pump and also a different site for the sensor. And that's really common. So the first sensor that I'd like to talk about today, and that's available for use and for kids, is the Freestyle Libre. So this is a little bit different than some of the other continuous glucose monitors, and if you look, some people argue, is this truly a continuous glucose monitor or not? But what it is a device that sits on top of the skin and will give you a blood sugar every time you pass the receiver. It's kind of like a pass-along over it. And it will give you a blood sugar. So it's not something that will read a blood sugar every few minutes, but every time you pass that receiver over it, it will give you a blood sugar, and then it will show you a graph. And so you can see that. Do you have a mouse here? No. Oh, sorry. Okay. You can see that on the device. You put this in. You can typically wear it for 14 days. It takes about an hour to warm up before you can actually start to use it, and it's fully disposable, so there's nothing you have to keep track of and hold on to. You can scan it through your clothing, and it's water resistant, so you can shower with it, you can go swimming with it. It'll hold up through that. This is a picture of Theresa May, who's the British Prime Minister, and she wears a Freestyle Libre. She was diagnosed with type 1 diabetes fairly recently. And then the other picture is a picture of how you scan it to get the blood sugar. And so this will give you a blood sugar reading every time you scan it, but again, it's not something that will continuously give you a number. There's currently a link that will send that information to an iPhone or a smartphone. This is an example in Europe, and so it's millimoles. It's not a blood sugar thing, so don't worry. And some things to consider about this is that at this time, it doesn't talk to a pump. It's not integrated to an insulin pump. There are no alarms, so this is not something that if your blood sugar is low, it will alarm you. And again, it doesn't give you a number every few minutes, and so it doesn't alert you. It won't alert you that you're going to be low or that you're going to be high. But it is approved for insulin dosing. So if you scan it and you get a number, you can use that number to dose insulin. So that is one option. One of the other primary mainstream continuous glucose monitors is the Dexcom G6. Oh, yes, thank you. Yeah, let me know if I forgot.
I'm new to all of this.
Yes, yes.
It's on your arm. Do you install that or does the doctor?
Yeah, so you install that. It's a very easy installation process, and for a lot of pumps and sensors, there's some training and some teaching. For the Freestyle Libre, it's actually very minimal training and teaching. A lot of people can pick it up from the pharmacy and put it in themselves. So it's a very easy installation process, and it's changed every 14 days. And so yes, you do that yourself. But I'm sure your doctors and nurses would be happy to help you. Great. Okay. Yeah. If I don't see a question, just let me know. I'm trying to stay close to the mic. So the second sensor I want to talk about today is the Dexcom G6. So Dexcom has been making continuous glucose monitors for a while. There's been the G4 and the G5, which many of you may have, and the G6, which you may have right now. So this is a sensor. When I first mentioned that some people, it's very appealing to the idea of not having to check blood sugars very frequently. And this is a continuous glucose monitor that really helps you achieve that. So this, if you look on the screen here, this tiny thing here is the transmitter. The sensor is inserted with this white and orange device, and then the receiver will be either a smartphone, or if you don't have a smartphone, you can still use this sensor. It comes with a receiver that looks very much like a smartphone. And so with this, there are no calibrations, and so there are really no finger sticks. If the goal is to check blood sugars less, then this may be a good option for you. It's fairly new. The feedback that we've gotten in clinic and from people that have been wearing it is that it's very, very accurate, and people have been very happy with it. Sometimes the thought of not checking a finger stick, I think, can be kind of scary for someone if you've been checking blood sugars for a long time. And so it's sometimes a period of adjustment, but the feedback that we've gotten is that it's been very accurate. You can wear this for 10 days. At 10 days, you have to replace it. If you've used sensors before and if you've used the G5, you know that there are ways to make the sensor last longer because they're expensive, and if they're working well, you want to keep using them. You cannot do that with this one because of how it's inserted, but it will last 10 days. There's a 2-hour warm-up period, and there is an optional finger stick calibration, so it doesn't mean you can't check your blood sugar. And if it's off, you can also address that. And it works with Android and iPhone smartphones. One of the advantages and one of the changes from the G5 to the G6 is this auto applicator. And so some of the feedback, I think, from the G5 sensor, the previous sensor, is that it's a little bit difficult to insert. This one is very, very easy. And the picture on the bottom is the two inserters from the G5 and the G6. The one with the orange on it, it's an auto applicator, and basically you place it on the skin and it inserts it. And so that makes inserting it in other places, the backs of the arms, a little bit easier. And the transmitter is smaller than the previous model. The alerts are customizable, and so one of the things that comes up frequently with continuous glucose monitors is the alarm fatigue and alerts that are very disruptive and wake people up or interrupt the school day. And so you can customize the alerts, and so maybe you only want to receive alerts at night if you're going to be low overnight, or you want to not receive alerts about high blood sugars during the day at school. They're customizable. The other thing is You can take Tylenol and your sensor will still work. So that was another thing with the G5. If you take Tylenol, the sensor stops working. This one, you're okay. Yes?
We're new to this as well. Can you still, does ibuprofen cause an issue?
No. Ibuprofen does not cause an issue. And with the G6, Tylenol doesn't either.
Okay.
Yes, it's just a quick thing to mention, especially during cold and flu season. And again, as with the previous system, the G5, the data can be shared. And so the receiver, where you see the information on your smartphone, a parent can also see that on their smartphone, for example. And so that can be a really attractive thing. And this is also approved for insulin dosing. So if you see the blood sugar, you can dose your, you can use that to do your correction or your and then Nick Jonas had a Dexcom. Nick Jonas is a singer. Yeah. Okay. Yeah, I mean, I'm not supporting any one particular product. I'm just, yes.
So with the G6, did you say, I mean, so you test the blood sugar and see the function of the G6 is 80/60. How do you fix, I mean, I know how to read the G5, but how do you fix that on the G6?
Yes, so there is a way where you can calibrate it, and so if there are issues, there's ways to go in and calibrate it, and then it should correct. The specifics for exactly the steps to do and how you do that, you have to ask the Dexcom people. I've used the G5. I haven't used the G6 yet, and so I don't.
Yeah.
It's hidden in the settings. Okay, thank you. But there are ways to address it, but.
You do a lot of actually put an icon up there. You have to put that.
Okay, perfect. Great. Okay. And then finally, the Medtronic Guardian 3 sensor. So this is a sensor that is made by Medtronic, which also makes an insulin pump, which is part of the closed loop system. And I'll talk about that a little bit more when we talk about pumps. This one, in general, it's best if it's used with the pump. However, if you don't have the Medtronic pump, there is an app that you can use this sensor and use it with your phone as a receiver. This one requires 2 calibrations a day. And when it's used with the pump, and again, I'll touch on this a little bit more when we talk about the pumps, there are options where you can set the pump to either stop delivering insulin for 30 minutes when you have a low blood sugar, or stop if there's a predicted low blood sugar, depending on the model of pump that you have. This is used with in general, if you're not using the Medtronic pump, not a lot of people use this sensor just on its own, but it is a sensor that's available. I'll talk about it a little bit more when we talk about the pumps. And then finally, this is available, and they have started doing some implementations in the US this last summer, but Eversense is an implantable sensor. It's a 90-day wear. So it's very tiny. If you see that very tiny thing with the blue bars on it next to it, that's the sensor that's implanted by a physician. It stays in 90 days. And then in order to, the transmitter is this black little box. So you still have to have something sitting on top of it, even though it's implanted, to receive information. One of the upsides to that for some people is that is removable, and it comes off easily, it goes on easily. And so if you're in a situation where you don't want to have that on, you can take it off. If it gets knocked off, it's easy to put back on. But this is kind of a new concept that is available. It does require 2 calibrations a day, and the receiver, you must have a smartphone to use it. Right now, it's not approved for insulin dosing, but it is available. Yes?
How is that taken out after 90 days?
It has to be taken out by a physician or a medical provider as well. It's implanted with some lidocaine and a small incision. It has to be taken out the same way.
It doesn't sound pleasant.
Yeah. Yeah. Most people do it like some part in the upper arm, and so there's different places where you could do it. But yeah, you couldn't take one out and put it in the same spot.
Do you know if you've heard about how accurate it is? Like, I know it's just not super dosing, but
Right. So I don't have personal experience or any patients that are using this right now. There are some people and there's some reviews you can find online that say the accuracy is fairly good. I think in general the general sense is that the Dexcom accuracy seems to be the best, and that's kind of the comparison that people will compare it to. It's from what I've read, and again this is just reviews online. It's not terrible, and I won't be the one to say that.
On the review.
Yes. Yeah, but a different concept. Okay, and so quickly for insulin pumps, I know for people that there are some people that have used pumps quite frequently. Others maybe that are new to this, the question would be, why would you use an insulin pump? And so for insulin dosing, typically when we teach multi-dose injections, you have a long-acting insulin, which is your Lantus or Levomir, and then you bolus with meal, short-acting insulin. With a pump, the Lantus is essentially replaced by what we call the basal rate. You only have one type of insulin in the pump. It's just a short-acting insulin, and you have a small amount that is injected through the pump into you throughout the day. And one of the advantages to pump therapy is that you can change that throughout the day. So when you give a shot of Lantus, you give the shot, the dose is the same all day. The basal rate you can adjust, so if you have frequently high blood sugars in the morning, you could increase the basal in the morning, and so that long-acting insulin lasts a little bit longer. The insulin pumps are external devices, so a lot of times people think, is it surgery? Are they implanted? They are not. And I'll show you some examples. And the site must be replaced every 2 to 3 days. So it's something that still requires some maintenance. Insulin pumps have come a long way. So the picture on the far left, right, your right, is the first insulin pump in 1963. It was a huge backpack. In 1979 was the first insulin pump that somebody could wear. It was not that huge. So you can see it. The little boy sitting there, he has. You kind of see that rectangle there. That was an insulin pump. So it's kind of this device. There's a big syringe with the insulin in it. And then today we have several options for pumps. On the top, there's an example of the Medtronic pump, and then the Omnipod pump on the arm right there. We're going to talk about both of them. So we've come a long way. There have been a lot of significant strides in this technology, which has been pretty exciting. And right now, there's kind of an emergence of lots of people that were making pumps in the last decade, and that's kind of dwindled down now. So there's basically 3 companies that are making pumps right now. Insulet, which makes the Omnipod, Tandem, which makes the T-Slim, and then Medtronic, which is the 670G, is the most recent model. So those are the 3 that I'm going to talk about right now. The Insulet Omnipod, this is a tubeless pump, and so like you saw in the picture, it sits directly on the skin. The picture of the white is the pod itself. You load the insulin directly into the pod, so that's the picture up on the top left there. The insulin delivery is managed by a personal data management, or a PDM, so it's a little bit bulkier than a cell phone right now, and you have to have that to bolus through the pump. The basal will run without it, but you have to have that. So if you're prone to losing things, it's maybe something to think about. And that PDM is also the glucometer that you use. So it works with freestyle test strips. You use that glucometer to test the blood sugar. That communicates to the pump. And that's how you decide insulin dosing and go from there. It is waterproof. You can wear it in the water, which is on that picture is right there. Some considerations for this. Because you're replacing the pod every time you replace the insertion set, the upfront cost is lower. So insulin pumps can cost, without insurance coverage, on $5,000, $6,000 sometimes. This one is closer to $1,000, and so for some people, depending on your insurance and the coverage, sometimes that can be something to consider. In the long run, some of the supplies can be a little bit more expensive because you're replacing the entire pod, but upfront costs can be a little bit lower. You can program it underneath your clothing, so if your pod is sitting beneath your dress, you can use your PDM to give insulin, and so that can be an effective option. And the cannula insertion, because it's all right there, it's automatic, and so you don't have to see a needle, nobody sees a needle, you put it on the skin and it inserts the cannula, and then the needle comes out. Right now, there's no current integration with a continuous glucose monitor, so it's not set up to talk to a continuous glucose monitor, and it can only hold 200 units, which for some of the smaller kids and many adults is not a big deal. If you need larger doses of insulin, sometimes 200 may not be enough for 2 to 3 days, and so you may have to replace it more frequently. And then again, one other thing to note is the insulin to carb ratios can only be whole numbers. So if you are one of those people or have a very, very small child that's requiring very small doses, the ability to adjust the insulin to carb ratios is a little bit more limited than some of the other pumps. Yes?
What do you do with the insulin? Say you put insulin in that and you don't use it all. What do you do with that?
Right, so if you don't use it all or there's something that happens and you need to replace it sooner, you can't use that.
We have the old PDM as of the end of last year. Do you know if there like a wait list to get the dash system or how that works?
The logistics of how that works, I don't know. I know there's a lot of vendors here and they may be able to give you specifics on that.
Okay.
And Dr. Sims will talk about the dash too.
Do you have to load that with the 200, or is the other dollars you have to be loaded with 100? Okay, yeah, what was the minimum? Yeah, it does. Yeah.
The minimum,
Yeah.
thank you. Minimum 70. Yeah.
It's good to know.
Yes, yes. Okay. All right. And so the Medtronic 670G, so this is the newest and probably the closest thing to an artificial pancreas that we have right now. This is an insulin pump and a continuous glucose monitor together. And so the way, if you recall the CGM picture where you have the insulin pump site and the continuous glucose monitor site, they will talk together and the pump is the receiver. And so the data from the continuous glucose monitor will show up on the pump. This pump uses a computer algorithm to automate certain aspects of insulin delivery. And so that's when we talk about the closed loop or the hybrid closed loop, that's what we're talking about, this computer algorithm that will predict how insulin should be given and essentially what that basal rate will be. You still have a carb ratio that you set, but the carb ratio and the insulin action time are the only things that you control when it's in this automated system or auto mode. So auto mode, it will automatically adjust the basal every 5 minutes based on the CGM readings. And if you don't do auto mode, there's also something else where you can just use the sensor, and there's a feature that will suspend it if you have a predicted low. It will do that for 30 minutes, and if the blood sugar is not low, then it will restart the basal.
Do you set different carb ratios if you have different ratios per minute?
Absolutely, yes, yes. The way the carb ratios are set and how you do that is no different than a traditional pump, and you can change that for whatever time of day. Yeah.
Will it share readings with like the parent's phone, like the Dexcom does?
Not right now. You go talk to them. Okay. So this is an example of what the receiver, if you look at the blood glucose tracings on your pump, this is an example of what it will look like. And then this is what the pump, the sensor, and the insertion site looks like here. There's a lot of information about pumps, and I know we're squeezing a lot into this session right now. There's some really good reviews online, and there's a integrateddiabetes.com is they're not associated with a particular company, but they review pumps and devices, and there's a really helpful, I thought was very helpful as a person with diabetes that's used this pump also, review online by Gary Schreiner. He also has diabetes, and so for more information, it's a good site to go to. It's integrateddiabetes.com. And I think we'll be able to send out these slides so you can have that link. But if you Google that or Google Gary Schreiner, you should be able to find it, or even review of 670G. The review that he has, some of the reviews, they're fairly current, most of them, and they keep things pretty up to date. And so just some considerations for this. We talk a lot about the hybrid closed loop, and it can do amazing things. I think the one thing to stress is that auto mode and this sensor and using it with this pump requires a lot of work and still requires a lot of finger sticks. And so, like I said before, if the goal of continuous glucose monitoring or a sensor is to eliminate finger sticks, this probably isn't a good option for you. There are multiple confirmation steps, and a lot of the feedback I think that Medtronic has gotten is you have to push a lot of buttons to get where you want to go, which is something that most people adapt to, but something to think about if that will be annoying or bothersome to you. And there are a lot of alerts, especially in auto mode, when you exit auto mode, if the blood sugar isn't good, and that can be a little disruptive. You have to be invested into really learning how the pump works to have it work well. And so I believe anybody can learn how to do this, but you do have to put in some time to do that.
Why does it require a lot of use?
One of the safety features is that the sensor and the blood sugar checks are very close. And so if the pump senses that there's something that's not quite right or wrong, it will require you to give another blood sugar. It requires the 2 calibrations a day, but then to go into auto mode to make sure those things match up, it frequently will ask for blood sugars. If you are out of range for an extended period of time, it will exit you out of auto mode, and to get back in, you will need to give a blood sugar. And so it's kind of high maintenance. A lot of that is safety. And I know they're continually working on improving the algorithms and improving some of the glitches that often lead to sometimes you'll be in this end where they're asking for blood sugars, but safety is one of the reasons.
One of the other things too, if you have a pump and something happens, there's supposed to be water slips, if they get a little back of water gets in, they send you a new pump within 24 hours, but the algorithms are not stored anywhere outside of the pump.
Right.
So it has to relearn your body for a couple of weeks.
Right.
You start all over.
Yeah, so this pump is still set with, you still have a basal rate that you set. It will function like a conventional pump, but you're right, if you have to replace it, it learns the algorithm by monitoring your blood sugar for generally about a week. It usually takes about a week for you to do that. And so if you have to replace it, you won't be able to go into auto mode right away. Yes, yes. Good, oh, do you have it? Oh, I want to talk to you. There is a new transmitter that is becoming available.
I think I think it also takes time for people to know your body, like especially if you struggle to trust it, because I struggle to trust the pump, but in the algorithm, so it takes like a good 6 months or so for I think as a person, as a human, to get used to the pump and for the pump to run you. And so at first there was a lot of things mistakes. I don't experience that as much anymore than I did maybe the first month. But like you said, it can be high maintenance at first as long as you let it learn you. It might be a little higher or a little lower than you want to be, but it just takes time for it to learn how to do it.
And that picture is just the injector. Oh, okay. I'm going to go through quickly so we get to Dr. Sims. There's a lot of upcoming things. This is the last pump. So the last pump to talk about is the Tandem insulin pump. So there are basically 2 pumps that Tandem makes right now. It's the T-Slim X2 and the T-Flex. But one of the biggest differences is the T-Flex has a much larger reservoir, and so if there's somebody that requires a lot of insulin, this may be a good option. It doesn't do a lot of the specifics, but it can hold up to 460 units of insulin. This is the first and only pump right now with a touch screen, which for some people was very attractive. It has a touch screen. It does integrate with the Dexcom G5 right now, and that CGM data will display on your pump, and so you can use that as the transmitter. Right now, there's no predictive algorithm, there's no closed loop system, and so it won't adjust insulin. The Dr. Sims will talk a little bit about what's coming up for that. This pump is very compact, in part because it doesn't have a disposable battery. It's rechargeable, and usually the charge will last about 5 to 7 days. And the insulin cartridge itself is kind of this flat one that inflates, and so the battery and the insulin cartridge are usually what take up the most space in an insulin pump. So because of that, this one's a little bit slimmer. And I think one of the nice things about this is that there is updatable software that can be downloaded from the internet as things improve. And so as they develop new systems or new features, you can download those onto your pump. Some considerations for this: some people say that the buttons can be a little bit tricky. I think with any pump, you get used to what you're doing, which is something to note. You do have to unlock it each time the pump wakes up, which is actually pretty consistent for most pumps, but that's so you don't butt bolus yourself, right? It's like a smartphone. And then the vibrate feature on this, you can set the alerts to either vibrate or make noise. The vibrate is a little bit weaker. The noise people have no problems with, but that may be something to consider. And right now it's not directly linked to any meter. So a lot of pumps, if you check a blood sugar on your meter, the blood sugar will be sent directly to the pump, and you can say, okay, this is the number, this is what I want to bolus. This one, you can't do that. So if you check a blood sugar on any meter, you have to enter it by hand to the pump. It does talk to the CGM, the Dexcom B5, but not to a meter. And so that's something to consider. All right, this is some people wear their hearts on their sleeves. I put my fingers on my hip, or maybe my arm, depending on what you're doing. And Dr. Singh is going to talk about things coming up.
Thanks, Dr. Felton. Okay. All right, guys. So first, I'm going to talk about what's out there in the near future for sensors. And so just so you guys know, all of these things, for the most part, are kind of press releases. Sometimes the companies can be a little dodgy about specific details. So don't hold me to dates. You know, a lot of times they'll give you kind of a projected date, and if things run longer than what they project and that kind of stuff. So first thing is Freestyle Libre. So they're coming out with a second generation sensor. This one is going to be more of a continuous monitor than what's out there right now. So like Dr. Felton was saying, some people would call the Libre that's available right now more of a meter that is an implantable meter, right? So this one will have customizable alarms for low and high blood glucose. So this is one thing that a lot of people don't like about this one right now, is that it doesn't kind of let you know about these things, right? And then there's going to be a notification of signal loss. So I think that'll be a significant improvement for this sensor. Right now they're working on regulatory clearance, or they've just gotten regulatory clearance in Europe, and they're working on it in the United States with the FDA. So hopefully that'll come this year, and then subsequent release in the United States. So I think another really exciting thing with sensors is the next generation Dexcom device. So G7 here for this one, Dexcom is planning on working with Verily. This is supposedly going to be lower cost. And another really big advancement is the size. So this is supposed to be much smaller scale, especially the width of the device. So you can see the picture here compared to the current G6 sensor. It's supposed to be the width of like a dime. So hopefully will be much more or less obtrusive. Supposedly this one is going to last for longer. So they said it's going to be 14 or 15 days of wear. And another new thing that I think is pretty cool, the transmitter is going to be part of this kind of dime piece, right? And so the whole thing is going to be disposable. So there's not going to be this kind of transmitter that you have to keep up with and keep hitting on over and over again. And so plans for this are a very limited scale release in late 2020 with the full scale release planned for 2020. So I think they're still kind of actively working on this device. Yep.
I'm sorry, do you know, would that be something that's auto upgraded like the G6 was?
I don't know about that, sorry. But you know, I think one really great thing about this is that all of these guys are out there. So you should totally grill all those Dexcom people about that. Okay, so I just wanted to mention there's another CGM system out there, the waveform CGM, that's supposed to be released in 2019. So this one is going to be 14 days of wear. This is still going to require calibration though, so it's not factory calibrated like the Dexcom and the Freestyle devices are, but it will connect to a smartphone. So I think that'll be nice. You'll be able to display it on smartphones. And then another CGM that's a little bit different that's supposed to come out next year in Europe is the Sugar Beat CGM. I thought this was really interesting. I hadn't heard about this. It's a non-invasive CGM. So here are two pictures of it. There's a patch that you wear that's the actual sensor, and it actually, it supposedly, you can't feel this, there's a little electric current that kind of draws the glucose out of the interstitial fluid in your skin and brings it into the patch so it can sense what your sugar is. And then you wear the transmitter on top of it. And so the nice thing about this is the transmitter lasts for a long time, 2 years. It's non-invasive. It does require calibration, once daily calibration, and it has a warm-up period. And this is not something that's invasive, so it's not going to be as accurate as one of those more invasive devices, right? But I think there are some benefits. So you know, it lasts for a long time because it's set up like this, where you put the transmitter on top. You can do that with an adhesive that's kind of less sticky than these ones that last for 14 days because you change it every day. So maybe people will have less problems with the adhesive with this one too. So I think that's another potential benefit. But it's released in Europe next year, so we'll see about United States. Okay, so let's talk about pumps. For Omnipod, they're planning on releasing the Dash pump in 2019. So this is kind of still a traditional insulin pump, so not closed loop, but it's going to have some new features. I think a lot of us struggle a little bit with the PDM for Omnipod, especially someone who doesn't have one and then looks at patients' PDMs when they come in. I think it's not the most intuitive device. So their PDM is supposed to be more intuitive with this Dash. And it's going to be a touchscreen PDM. It's also supposed to allow access to the data on your smartphone, so it's going to have Bluetooth to do that. And then I think another thing is that the device is going to include multiple mobile apps to work with the device on your smartphone, and this is eventually going to include the Loop app from Tidepool, which I'm going to talk about in a little bit, which is really exciting. All right, so Omnipod is also working on their own closed loop system. So this is going to be a hybrid closed loop system. It's called the Verizon Hybrid Closed Loop System, and the expected launch for that is in 2020. So this is going to be another hybrid closed loop. So you're going to have to tell it carbs and dose for carbs. But this is going to supposedly interact with your smartphone. So you're going to be able to control it through your smartphone, which I think is going to be really nice. And the algorithm is going to be in the pod. So even if the phone is out of range, you'll still be able to be in auto mode. And be active. So for Tandem, right now they have this basal IQ system that has the predictive low suspend, right? But they're planning to launch a hybrid closed loop in 2019. So again, this is going to be a hybrid closed loop. It's going to work with G6, and it's it'll automatically add corrections for the low blood glucose. So one thing I've heard about this is that the time and range is not as great for this system as it is with the